My name is Joseph Mendy. I am from the Gambia, working in Edward Francis Small Teaching Hospital. I am a registered nurse. I work in the intensive care unit for some years back. I was selected by Merck Foundation to come and study, to have training program in Krishna Vidapith in India. In my country, the number of specialists is very, very limited. I'm afraid to say in my country, we also have very limited access to healthcare, especially in the rural area. We have only one intensive care unit in my country. And in terms of training, we don't actually have a curriculum, a program running currently in our country, in our schools, in university and college, which is specialized in intensive care unit or other fields. We may have few fields which they specialize, but not intensive care unit. So intensive care in particular is actually not, many people are not actually trained in intensive care in the Gambia because we don't have training institutions where they train people on the specialty. In the Gambia, a patient ratio, especially in intensive care, as I alluded earlier, patient ratio is high. Maybe one nurse is to take care of 10 patients. Or in intensive care in particular, one nurse could take care of 4 patients. And therefore the patient ratio is not very impressive. Merck Foundation come at the right time to be able to give people like me an opportunity to be able to go out of my country and have experience in different culture, different orientation, and of course with more equipped materials, capability to be able to familiarize myself for better patient management and care. So I cannot say enough to thank Merck Foundation for that. My expectations were to be able to have the opportunity to be able to be exposed with because we live in the technological era now. So be able to expose with the medical equipments, like more exposure, even though I have some in my country, like ventilators. We're able to be exposed more on the ventilators to manage with different cases, different patients, ranging from neurosurgery, intensive care, surgical intensive care, medical intensive care, of course nephrology intensive care, pediatric intensive care, and different expertise. I was hopeful and very high in hope I will be able to gather that required knowledge and skill to be able to effectively do my work to the fullest. This play a very positive impact in my life as an individual. It was able to give me an opportunity to see deal with different patients with different culture, with different orientation, and also expose me to more advanced equipment, medical equipment, to be able to help assist me in my career, in my job, to be able to effectively deliver my service to my patient in my country, and also serve myself with the knowledge required to be able to execute wherever I find myself, to take care of my patient in any given point in time, whether in the rural or urban. So I'll be able to share this knowledge, I'll be able to share this skill, so that it will be spread for better patient care outcome. My advice to the students to utilize the knowledge acquired in this 3 months training, the opportunity to give into them. It was not for them only, it's for them and for the hospital, the institution they work for, and the community they came from, to be able to go back and impact and make difference for better care, patient outcome. I definitely want to thank Merck Foundation for giving me, first of all, the opportunity, which I alluded earlier wouldn't have been possible for me to be able to come out and sponsor myself and then do this program. I must thank them